This week, the Trump administration is calling for a big change in the childhood vaccine schedule to split up and space out the shots. The president signed an executive order yesterday promoting his long-held and widely discredited belief that kids should get one shot at a time. The president also shared some false claims, and we just have to say this isn't a political statement. The claims were false about vaccines. So we brought in our 9 News health expert, Dr.Kohli, to help clear things up. And, you know, we've gotten to the point in this country where when we talk about vaccines, it's automatically political. But at the base of this, at the foundation, is science. So the president wants to split up the MMR vaccine, calling it quite lethal. And we've been doing it this way since like the early 70s. And nowhere is there evidence that says it has been quite lethal, is there?
Absolutely no evidence, Phil. You said it exactly right. I mean, decades and decades of showing the safety of the MMR vaccine given together, not having a link to autism. And now the president comes out with these claims that really are not based on new research. There's no new findings. There's no new studies to suggest this, that what we've been doing is wrong. Now, I will say, for full disclosure, the vaccine is associated with a slightly increased risk of allergic reactions and febrile seizures. But that risk is so small compared to the benefit of the vaccines. And there is an MMR-V vaccine, which is the measles, mumps, rubellas, and varicella. That one significantly increases the risk of febrile seizures. So
there's a fourth in there.
Yes.
Okay.
So there's good data that you should split the V, but not good data that you should split the MMR, because those given together increase compliance. They get your child vaccinated early, which is what we want. And there's two sets of MMR vaccines, one at a year and one at 4 to 6 years. So if you split it up, you're talking going from 2 visits to 6 visits to get that entire series.
So I got to know what pediatricians think about this. But first of all, I can tell you from a parent's point of view, the idea of taking them more than once and having to even watch it, nightmare. But that's
not to mention the cost of it.
And then remembering it and scheduling it. I mean, that seems like a lot.
It is a lot. In fact, many data and studies have shown us that if you split it up, you're going to get less vaccinations, right? The American Academy of Pediatrics, the World Health Organization, the CDC have all said the MMR vaccine given together is safe and effective. The MMR vaccine is not linked to autism. And the Infectious Disease Society of America has even gone so far as to say that this is irresponsible. So you're not just talking about the MMR vaccine, you're talking about all the others. Now, usually at the 1-year visit, we give 5 sets of vaccines. Now imagine splitting all of those up. You're talking about, instead of 1 visit, 8 visits, the logistics of it, what have you.
The money.
Every
time you go.
The copays are way for preventive visits, so that may not be as much of an issue. But think about your poor child having that kind of side effect profile every time.
Yeah, it's awful.
Think about multiple injections, right? You're giving the kid actually more injections.
Nope.
And you're going to reduce herd immunity, which for measles, by the way, for the first time ever, we're already under where we should be, which is 93%. So it's actually going to be worse for kids, not just for protection, but logistically speaking, certainly worse for parents as well.
Every time the president has brought this up, he's been asked by some member of the media, where's the evidence? RFK Jr. will say different things, but yesterday in the Oval Office, the president said, I've heard some people say that it causes. The president of the United States, who's doing an executive order, executing an executive order, said, I've heard some people say. He also said that the volume of injection given to kids is like, I'm going to quote this, like a bottle of soda, like a vat that you pour into a child, he said, and it can have, traumatic effects on a child. And we've all seen the vials that we've given to our kids. Do you know why he's making that claim?
Just for context, a vaccine is 0.5 milliliter, and a bottle of soda is 355 milliliters. And so if you combine all 5 sets of vaccines that a 12-month-old might get, you're talking 2.5 milliliters, which is half a teaspoon, as opposed to a bottle of soda. So that certainly is not true. In fact, it is unsafe. It is physically impossible to inject a bottle of soda into a toddler's arm. So that certainly is not a founded claim at all. There were some questions raised about whether the efficacy of the MMR might be less if given together. Certainly this came up during the COVID pandemic, that if you give more than 1 vaccine, is it not as effective? That has completely been debunked. In fact, it's more effective. And if anything, I'm looking at this at least as the glass half full, that the president has at least acknowledged that you should get the MMR vaccine, even though he's saying you should split it up. But I think that's an important point, because in the past they've said vaccines are linked to autism. Now they're actually saying you should get the vaccine, both RFK Jr. and the president.
So confusing, all of it.
very confusing. So if I was a parent, I would do a few things. First is knowing that it's going to take years for companies to manufacture separate MMR vaccines. Those do not exist right now. So you don't have to worry that this is going to happen imminently. Every state makes their own decision. Here in Colorado, we are making our own decision, and we are still giving the combined vaccine. But I would double check with the child's pediatrician and just ensure that they are getting the full series. And I really would follow the advice of the American Academy of Pediatrics, Infectious Disease Society of America, that says, give it together, protect your children, protect them early, especially with measles cases so high.
Well, thanks as always for breaking it down, especially on an issue like this, especially for first-time parents who are, you don't want to hurt your child in any way, and then someone's telling you that. So we really appreciate you coming on and doing that.
Thank you.